It's a challenge that policymakers face. And even though financial inclusion or ensuring that every Indian has access to money, whether it's loans through state-run banks or insurance, has been a mantra of the government, a lot more still needs to be done. And nowhere is the need as much as in basic healthcare. Insurance here can protect millions and ensure that a simple illness does not mean bankruptcy, as often is the case. For Kiran Mazumdar-Shaw, one of the best-known names in the Indian healthcare sector, healthcare insurance is an important and crucial cog in the wheel to ensure that the best of healthcare reaches all.
Hello and welcome to India's Healthcare Challenge with me, Kiran Mazumdar-Shaw. My guest today is Analjit Singh, the chairman of Max India, one of the leading healthcare stakeholders in our country. And over the next 30 minutes, I will be having a very interesting conversation with Analjit to talk about various aspects of how we can build a sustainable healthcare model with a sustainable insurance support system. Analjit, thanks so much for coming on this show. Now, you're someone who's really playing a very key role in insurance, and there has been a suggestion that whilst the government should be a health insurer or the health insurance provider, at least at a very basic level, the private sector health insurance companies should actually, provide the tiered health insurance kind of structure where you sort of top up on the health insurance needs and schemes and products. What do you think about insurance?
It's a very difficult and complex subject and question. Health insurance was never seen as a standalone vertical. So typically when you went to the PSU insurance companies, who were not standalone health insurance companies, they bundled health insurance in. So when you bundle something in, you are not pricing it mark to market or not pricing it to cost. So that set a very, very low table for health insurance pricing. So typically these insurance companies who price their products based on not actuarial, not realistic, not market-based data and experience, found that 100% of the time the claim was more than 100% of the premium. There can be no business model, because the fundamental of insurance is that hopefully on an actuarial basis over 10, 20, 30 years, the claims are less than the premium, and that margin or surplus is really what gives you the return in the insurance.
And the sustainability.
And the sustainability. Now that wasn't happening because 100% of the time the claims were higher than the premium. So when these standalone health insurance companies, or Sahis as we call them, came into the market, they started to price health according to the specific product. What are we delivering? What are we offering? What is the likely price and cost of that based on some projected actuarial basis of claim profile, if you will. So therefore, the private health insurance companies are charging more premium because their pricing is more realistic relative to these, may I say, at the cost of being sounding critical, the fuddy-duddy, public sector non-life companies who also do health. So a huge shift and adjustment is required. That means that firstly, these PSU general companies, non-life companies, I think should exit that space. And with more private health insurers coming in, there should be market-based pricing. And in this country, with the private life insurers coming in, there's such strong contest that you are getting best-in-class service, best-in-class product, very, very aggressive pricing, and so on and so forth. The same thing needs to happen in health insurance. Frankly, I think more should be left to the private sector. I'm not calling it public-private partnership. I'm calling it more government-private cooperation. And if government would listen to the private sector, I think if there are just 2 things or 3 things the government did, that is a favorable land providing policy, because land is too expensive at market rates for healthcare providers to acquire urban. It's practically out of bounds, but even in semi-urban and some rural areas. That's one area. The second area where government can help is encourage private sector to come in for medical education, for building training at schools for wellness professionals, allied health professionals, nursing professionals. Once that supply side goes up, the cities will decongest, the doctors will want to go and work in the semi-rural areas. But so long as the education the human resource is constrained, this shift is not going to happen. Of course, we can always go back to the finance ministry and ask for tax breaks and ask for some concessional soft loans and 30-year, 40-year money at some concessional, interest rates for borrowing and so on. I think those
are mechanistic kind of issues.
But that's where the problem is.
It's an irony that in a country where the government promises healthcare to all, the bulk of Indians don't have access to even the basics. And those who can afford it opt to use the private healthcare facilities. In fact, over 75% of healthcare expenses in the country go towards the private sector. While the big challenge for the government is to improve its healthcare facilities, it can partner with the private sector. And one way of doing so could be through ensuring good health insurance. In fact, micro-health insurance programs like the Arogya in Andhra Pradesh and Karnataka's Yashaswini have been model insurance schemes that can be introduced elsewhere. So, how can the public and private sectors combine their strengths?
A lot of the state governments have started rolling out these micro health insurance schemes, and you have a number of these schemes, whether it's Andhra Pradesh or Tamil Nadu or Karnataka, we've got all these insurance schemes coming out. Over and above that, we've always had ESI and many other, sort of public sector insurance schemes. How do we really sort of get the government to play an important role in ensuring that they are involved in supporting the healthcare system, because you do need the government to also support you in some way in building the sustainable model where they must make some money available for reimbursement?
I think, I'm afraid what may appear to you as a general response to me is a very specific response. The fact is, for every incremental rupee being invested in the healthcare sector, across the board, about 75 to 80% is coming from the private sector. This is a fact. The point I'm trying to make is that from these rural healthcare schemes, etc., if these rural healthcare schemes are realistic and they are sustainable, I see a role for the private sector there. I think the private sector will find the model, will create the model to become effective, efficient, and sustainable. And that will then bring the provider space, that will bring the education, that will bring the insurance space, and I think then you have all three sides of the triangle working in tandem.
So what you're basically suggesting is a model where the government is basically a facilitator or an enabler.
Exactly.
By saying, allow us to basically afford to build hospitals or clinics.
May I give you an example? The